If we had to look for a silver lining in this coronavirus pandemic, one might be the fact it highlights society's need to come together to care for our most vulnerable. To discuss this, we are joined via Skype by a Catholic medical doctor and the founder of Modern Mobile Medicine, Dr. Matthew Haden. Dr. Haden, thank you for being with us. Putting a stop to this pandemic really requires everyone in our nation, in our world, to come together and cooperate with health guidelines. Can you speak to how, when someone stays home, it's not just for their health, but for the health and well-being of their neighbors and loved ones as well?
Exactly. We really do have to pull together to protect the most vulnerable. You may not understand that there's ripple effects. If you catch this and you have mild symptoms, you still may expose someone else who may carry it back to a vulnerable family member, someone with respiratory conditions like emphysema, someone with diabetes, a NICU baby. You don't know the ripple effects and downstream effects that not staying home can have if you do pick up this virus.
This pandemic really counters the claim that it's my body, my choice, because we are seeing how decisions with our bodies impact others. And by practicing social distancing, that's really upholding the dignity of others' lives too, isn't it?
Absolutely. It's a small sacrifice we can all make that reflects our values, that we do respect the dignity and inherent value of every life, not just our own. So we do ask people to make that small sacrifice and understand that every life has value, and we have to do everything we can to protect it.
Absolutely. You know, Dr. Haden, it seems the coronavirus is impacting younger people more significantly than we originally thought. But earlier
Correct.
on, it was common to hear people dismiss the coronavirus because they thought it only impacted the elderly. Can you speak to why rhetoric that dismisses the dignity of the elderly or immunocompromised is dangerous?
Right. It goes back to the inherent value of every human life, and we shouldn't be assigning value to people based on stage of life, health condition, ability, or disability. Every life is important and has an inherent dignity and value for us as Catholics and hopefully in the eyes of every human being. And we do all have to pull together to protect those lives. We sort of got behind the ball. We were a little casual early on and didn't realize the threat that this posed. And now we're playing catch up. So the more aggressive we get now, the quicker we can end this, the quicker people can get back to work. We really do need to make the sacrifice now and be aggressive about stopping this.
Dr. Haden, how can the pro-life movement support the medically vulnerable during this pandemic?
I think it's important to look out for your loved ones, your neighbors, your fellow parishioners who might be vulnerable and shouldn't be leaving the house, who it might be more risky to go to the grocery store and get supplies. And if you can pick things up for them and leave them outside their door and not have contact with them, that is something you can offer to them. You know, we do have a graying of the priesthood and of the parishes and the pews, and it would be nice if people look out for our priests, for your own pastor, and make sure they're taken care of, and anyone that you know has any health issues.
These are really beautiful ideas. There's been an uptick in telehealth because patients don't want to risk getting sick by visiting a hospital. Your patients don't have to worry about that because you come to them. Dr. Haden, can you tell us about the vision behind Modern Mobile Medicine and its truly pro-family approach?
Right, sure, I'd be happy to. I really designed my practice to make it as convenient as possible for families with children to get their medical care. There's so many difficulties and pain points with the regular system, and families are bouncing back and forth to urgent care in the doctor's office. So we offer our care through house calls and telemedicine. So we've done telemedicine from the beginning. It's part and parcel of everyday care for us. It's just part of medical care. It's nothing new or unique for us. So during this time, our patients have really been fortunate that they're familiar with it. They don't have to leave the house. If they have a small need, they can reach out to us. I spend my days now responding to all those requests by text, video chat, phone call, and then if we absolutely need to, I can see them in person.
That's beautiful. And can you give us a quick example of how families really benefit from this practice?
Sure. Right now we're handling as much as we can virtually. That's the recommendation from the CDC, so that I, as a doctor, don't end up inadvertently spreading the virus. But some things do need to be seen in person. So I had a family yesterday with an injury, a deeply embedded splinter in their teenager's knee that they couldn't get out themselves over the weekend, and they drove over an hour just to avoid the big health centers, the hospitals, the urgent cares, that they didn't want to be exposed to the virus. So they came to my small office, and I was able to help them out in that need.
That's incredible. Thank you so much for joining us and for your insight. Dr. Matthew Haden with Modern Mobile Medicine, thank you.
Thank you for having me.